Ever wonder how mothers are able to provide support to their babies during development? During pregnancy, the fetal circulatory system works differently. The umbilical cord connects the fetus to the placenta, which is an organ that develops and implants in the mother's uterus. The heart and great vessels form bilaterally and fuse medially beneath the foregut, which will differentiate into the aorta. At 8 weeks gestation, a fully functional, multi-chambered heart is formed. The yolk sac forms blood islands at week 3 of gestation. This is the very first area for hematopoiesis, which is the formation of blood cells. Blood vessels in the systemic circulation are developed from somites. There are 3 stages in blood vessel development. First, specification of the angioblasts, cells that differentiate into blood vessels. Second, vasculogenesis, where angioblasts create the primary capillary plexus. And third, angiogenesis, which is the reorganization of this plexus to form new branches. 3 structures in the fetal heart serve important functions. The foramen ovale is a connection between the right and left atria, allowing oxygenated blood to bypass the lungs. The ductus arteriosus moves blood from the pulmonary artery to the aorta. The ductus venosus stunts blood directly from the placenta into the inferior vena cava from the umbilical vein, bypassing the liver. Oxygenated blood enters the umbilical vein and travels through the inferior vena cava to the right and left atrium, left ventricle, and aorta, and into systemic circulation. You may also be wondering how this now deoxygenated blood leaves the fetus to become oxygenated. This blood moves through the superior and inferior vena cava to the right atrium and ventricle and onto the pulmonary trunk, aorta, umbilical arteries, and back to the placenta. When the baby is born, the umbilical cord is clamped and it will no longer receive support from the mother. As the baby breathes, changes within the body indicate that the shunts are no longer needed and they close, completing the change from fetal to newborn circulation. But what happens when things go wrong? Any abnormalities in fetal circulation adaptations during pregnancy can lead to a defective heart structure. In most cases, we don't know why these defects occur, though some heart defects can be genetic or be related to a disease that the mother has. There are many types of heart defects. Congenital malformations can be cyanotic when deoxygenated blood enters circulation due to improper closure of the foramen ovale. Septal defects can be atrial or ventricular when an opening in the heart causes improper blood flow. Pulmonary and aortic stenosis occurs with either right or left ventricular outflow obstruction. In severe cases, teratology of Fowler can be seen. This is a combination of 4 congenital abnormalities that leads to insufficient oxygenation of blood. The conventional approach to diagnosing fetal heart defects is echocardiography or an ultrasound. Pulse oximetry screening can also be beneficial. But, above all, regular physical examinations and talking to your doctor is always recommended.